Welcome to this week's benefit breakdown. I'm recording this on a Friday. It's fourth quarter. I'm frazzled. A lot of our clients are frazzled. And just thought maybe we'd have a little bit of fun. So, if there's any Austin Powers fans out here, this week's topic is part two on HSAs. No pun intended with part two, but this is going to be who does HSAs work for? So, simplest way to explain who really works best with having an HSA would be two categories of people: healthy people and sick people. I understand that seems pretty basic, but here's why. Healthy people typically aren't using their insurance anyway. So they're basically paying a premium for something that they're not getting really any benefit from. An HSA gives them an opportunity to hopefully save money, assuming the HSA is their less expensive option, save some money on premiums, hope they don't have to use the insurance anyway, and if they're smart, they'd set aside some of that premium savings and put it into a health savings account to be spent on future claims down the road. So pretty easy to understand why a healthy person would do it. Additionally, a sick person could also benefit from an HSA, and here's why. People that have a lot of medical claims are probably already hitting their out-of-pocket maximum, which is usually a pretty big number on their plan anyway. With an HSA plan, they're just going to hit that out-of-pocket maximum sooner, so they may hit it in January or February versus hitting it at some point in the middle of the year. But again, the out-of-pocket maximum on an HSA is probably the same or less than some of their other plan options, so it's the same money. Now they can save some money on their premiums because the HSA plan should be less expensive. And because they're already spending that money on their out of pocket, they can put money into their health savings account to then pay for those claims going towards the out of pocket maximum. So now they're getting the tax benefit of the money that they're already spending anyway. So that's who they do work for. Here's who they don't work for. They don't work for people that have kind of middle of the road claims. So what that means is someone who takes a few brand name medications, maybe someone with children that are constantly getting hurt or, having sicknesses or illnesses, someone that has a lot of specialist visits throughout the year or I can't even speak. I'm so tired today. Frequent lab work. And then the main obstacle is someone that just can't wrap their head around the fact that their plan does not have set copays. So how could you test drive an HSA? So this is how I tell my clients to think about how an HSA would work. First, run your prescriptions through GoodRx because that'll give you an idea of what the total cost of those drugs are. Second, go find an EOB from your current plan and see what you're paying for that allowed amount. And find an EOB for office visits. If you have lab work, look at one of those EOBs. If you've had imaging in the past or maybe an expensive claim in the past, pull that up and look at the allowed amount. The allowed amount is going to tell you what you probably would have paid if you had an HSA. And a lot of those numbers are quite a big difference whenever you're accustomed to just having a small copay. Anyway, appreciate your time. I hope this has been beneficial. That's an easy way of how I like to explain how HSAs work. Hope you learned something. Hope you have a great day, great weekend, whatever it may be. Take care.